Yeah, I'll react to that, sure. Okay. Hi, guys. I want to do a healthcare NHS video because I'm doing this too, but I'm doing a gun laws video as well. I haven't done one of these types of videos in a bit, but I do enjoy doing them. Of course, I have my political opinions just like anyone, but I hope, by no means unable to be swayed, for sure. I think it's a big problem nowadays. People get, set kind of like a sports team. They're a fan and they don't want to admit their side is wrong because they'll be embarrassed or something like that. I don't know. I admit I don't know nearly enough about this to have an expert opinion, that's for sure. But I have my own thoughts. But I'll excited to see your guys' comments and answers to any of my questions, which I'm sure I will have many, but I will try to not make it a 30-minute video. So let's go.
Approaching Sanders presidential race, Super Tuesday came and went.
How the United Kingdom's healthcare system works. Okay, NHS.
And the Democratic presidential race is narrowing to two very different candidates, far-left Bernie Sanders and the more moderate Joe Biden. Biden and Sanders have clashed on the best approach to reforming U.S. healthcare. Sanders wants to get rid of private insurance altogether, while Biden proposes building on the framework left over from Barack Obama's Affordable Care Act.
Bernie says that you have to bring people together and we have to have Medicare for all. But Bernie says, and he says he wrote the damn thing, but he's unwilling to tell us what the damn thing's going to cost. The idea middle-class taxes aren't going to go up is just crazy.
What Medicare for All will do is save the average American substantial sums of money.
The U.S. already spends more money on health.
This is a really comfortable position I'm sitting on the piano thing, but when I tilt it, it's pretty nice. Okay, sorry.
Substantial sums
check out the chart.
of money.
The U.S. already spends more money on healthcare than any other
Per capita, obviously. Wow.
developed country. There's one country that spends less than half what the U.S. does on healthcare, and people generally don't pay anything out of pocket when they go to the doctor. The United Kingdom. And out of all the healthcare systems we've looked at, the U.K. appears the most socialist. The government effectively runs the whole thing. Right now, the U.K. is having its own debate over how to reform the National Health Service. So how does the U.K. system compare to the U.S.? And what reforms may be coming?
So a few answers to some questions I have are, first of all, if anyone tells me that there are no issues in a healthcare system, I'm gonna assume you're hiding something. So there's got to be some cutbacks in both kind of styles of attacking healthcare in a country. But so it's free. Like you can, let's say I don't feel well tomorrow. Can I just like go walk into a place and be like, hey, this doesn't feel good. Can I get it checked out? And then you get it checked out and it's like, oh, no bill. I'm fine. And you can go? Or is it more free in terms of bigger surgeries? Does that make sense? So, okay. Or services like cancer treatment and stuff like that, all the way to, I don't feel that great. I wonder what's going on. I'm going to go to the doctor. Or is there a limit?
In 2018, the United States spent around $10,500 US on healthcare for each of its residents. The United Kingdom spent around $4,000 US. That means the United Kingdom spends 9.8% of its GDP on healthcare, while the US spends 16.9%. Despite spending less, the United Kingdom manages to have healthier citizens who live longer and are less likely to die in childbirth. In 2017, life expectancy in the UK was 2.7 years higher than in the US. And the UK has roughly 1.5 times fewer deaths that could have been avoided by access to better healthcare. The infant mortality rate is low.
That's significant.
Fewer deaths that could have been avoided by access.
1.5 times. So does that mean there are 50% more preventable deaths in the US than in the UK?
And the UK has roughly 1.5 times fewer deaths that could have been avoided by access to better healthcare. The infant mortality rate is lower in the United Kingdom, with 3.9 deaths per 1,000 live births, as opposed to 5.8 in the United States. And the maternal mortality rate in the US is nearly 1.5 times higher than in the United Kingdom. So how is the UK system structured so that it gets these results while spending significantly less than the United States system?
The National Health Service is a case where the British decided right after World War II that healthcare should be government's job, like paving the streets, putting out fires, running the library, running the parks.
Stuff like that.
That's T.R. Reid, author of the book The Healing of America. He traveled the world exploring different countries' healthcare systems.
It's a service you get when you need it, and you never get a bill. It's like going to the library. They don't charge you to check out a book.
Key thing about the NHS is it's a risk-sharing system, so everyone pays into it through their tax. If you need to use it, you don't have to pay anything else.
So the risk-sharing service, do you find that I don't want to sound like I'm just risk-sharing service. Does that promote a sort of people like poking at you if you're like smoking cigarettes, or if you're overweight and you're eating something unhealthy or something like that? Like, does it create that sort of atmosphere? And I don't want to, anyways, okay.
Risk-sharing system, so everyone pays into it through their tax. If you need to use it, you don't have to pay anything else. So in a sense, it's not free because it's paid out of taxation.
Dr. John Puntis is a pediatrician who recently retired from the NHS. He is also co-chair of an organization called Keep Our NHS Public. All of his comments are reflective of the organization and not his personal views.
It's a fair system in that the more money you earn, the more tax you pay, and the more you contribute. But there has been discussion about whether tax should be increased to pay for sorting the NHS out in terms of the current deficiencies and problems, and that is controversial. I think a lot of people favour some tax increase, but then there are other people who say, well, maybe the focus should be on companies that don't pay tax and people that aren't paying tax as the first step.
So I would call that socialized medicine. Government provides the care, government pays for the care, it's paid for through taxes, everybody's covered the same. To me, that sounds like socialized medicine.
The term socialized medicine has become a political football, especially in the United States.
If the NHS, if that's socialised medicine, it's great. And we hear this term mainly coming from the US, where it's used as for scaremongering. I would say if the NHS is socialised medicine, we like it, and most people are still very, very supportive of the concept of a national
Socialized. So are utilities socialized? Is highway maintenance a socialized thing? So we're getting caught up in the term socialized here, but he was just saying before he wants it no different than something like utilities or highway construction, policing, stuff like that. So if that's just what socializing mean, then yeah, I think we're getting caught up on a term here.
health service.
Each of the UK's 4 constituent countries have their own branch of the NHS, so rules differ slightly between them, but all of the branches operate under the purview of the UK Parliament. There are some services that require patients to pay something out of pocket, such as dental, eye care, and certain prescription drugs, but those fees are low compared to the US and vary by NHS branch. By one estimate from a data analytics firm, prescription drugs cost 57% less in the UK than they do in the US. Unlike with other universal healthcare systems that are only publicly funded, the government also runs the NHS. That means doctors that work in public NHS facilities are employees of the government. Most Britons receive their primary care through general practitioners, who are frequently referred to as GPs. They typically act as gatekeepers for secondary care.
The problems that people are experiencing at the moment is it's taking longer to see your general practitioner if you want to see them.
Most GPs are private contractors with the NHS. They don't charge patients for care. Instead, they earn money directly from the National Health Service. Many GPs negotiate contracts with the NHS to determine how much they can charge the government for their services. GPs...
Well, why don't you just, in order to avoid shortages, maybe this isn't doable, just make it so that you don't have an extremely educated, highly qualified person looking at something on a patient that someone, like a nurse could do. Don't have a, and so maybe delegate the less serious issues that patients have to less educated workers, and if more stuff is needed, kind of go up there, so you don't have someone with a lot of expertise wasting their time on something that, you know,
may fund their own general practice facilities, or they can rent them from the NHS or private companies. One paper from the Journal of the Royal Society of Medicine found that GPs face many issues because of how general practices are funded in the UK.
Some GPs, I think increasingly, don't want to take on the running a business aspect of general practice. And so there are lots of GPs who are salaried partners, so they are paid by the practice to come in and work as a GP, but they don't do any of the business side of the stuff.
There's also a private sector in the UK's healthcare system. It's funded from a combination of out-of-pocket payments, private health insurance, and the NHS itself.
The private sector is growing because it's being consciously promoted by government, and the boundaries being blurred.
Well, I think that private healthcare has been growing at a very rapid, steady pace in the United Kingdom for the course of several decades. That's going to continue.
That's Niall Gardner. He's the director of the Thatcher Centre for Freedom at the Heritage Foundation.
With regard to the National Health Service, I mean, there's no sign at this stage that the UK will be moving to a different system to the National Health Service. All British parties are committed to the National Health Service. I think that more and more Britons will be opting for private healthcare in the coming years and decades, not least because there are long waiting lists with regard to the National Health Service.
An analysis from the London School of Economics found that in the 2018 to 2019 fiscal year, NHS England spent around 18% of its total expenditure on the independent sector.
There's been a blurring of the boundaries, if you like. For example, cataract surgery, which is the most common operation done under the NHS. Increasingly, it's being provided in the independent sector, and the NHS has contracts with the independent sector to do that work. There are implications in terms of staffing. Private sector doesn't train its own staff. It takes it from the NHS. It cherry picks, takes the low-risk patients, not the high-risk patients. It has an impact on training NHS staff, and this is one of the problems with cataract surgery.
Well, that doesn't sound like a very bad thing. What are they supposed to do if they... It's not like if you go to the NHS, then if you kind of go back and delegating some stuff back to the private sector because it's reasonable, that doesn't mean like you're failing the NHS service. So I don't see how that's a bad thing unless I misunderstood something.
NHS staff, and this is one of the problems with cataract surgery. If they're all going to the private sector hospitals, then the NHS staff don't become experienced in doing cataract surgery, and then along the line you find it's more difficult to staff your NHS unit. So it's not.
This is what I feel like government isn't as great at at the private sector, is incentivizing good workers. So, like they're saying right now, the people getting experience on the cataract surgery because of, too much demand in the NHS, well, then you're going to delegate it to the private sector, or too much demand to nationalized health professionals, and then delegating some sector of it. like cataracts to the private sector, then why would those more experienced people want to switch jobs back to the NHS if they're getting paid more over there? But then couldn't you just kind of offer them government salaries competitive with their private sector cataract surgery salary?
Not without negative consequences. We are paying private companies increasingly to do work for the NHS, including American companies, and they're very well established now, particularly in back office functions and providing advice on commissioning support, this kind of thing. They're very involved, and unfortunately that's likely to increase, and it's something which campaigners are extremely worried about.
I don't think.
Well, I don't understand why can't, if you're nationalizing it, why can't you work with the private sector cataracts? Like, if you eventually do take back cataract surgery, for instance, into a NHS service, and less so a private service, then wouldn't you just kind of take those employees over and then pay them a similar amount that they were earning? I don't.
If anyone really believed that UK voters would decide to Brexit.
The news that the United Kingdom voted to leave the European Union shocked the world. The NHS was a big part of the Brexit media discourse, with the Leave campaign famously claiming that the UK would take back £350 million a week that could then be funneled into the NHS. The UK Statistics Authority has since said that the claim is a, quote, clear misuse of official statistics.
My name is Holly Jarman. I'm an assistant professor in the Department of Health Management and Policy at the University of Michigan. Those promises really did hit home for a lot of people. The idea that money would come back from Europe to the UK was a very powerful symbol. It's not actually true. That wasn't really how EU financing works. But we still saw that was a big part of the media discourse and most likely part of people's judgment when they were casting their vote.
The UK officially left the EU 3 years after the original Brexit vote, entering a transitory period through the end of 2020 while the UK government negotiates international trade deals. The concerns about private American corporations engaging more with the NHS came up during the discussion of the post-Brexit trade talks with the United States.
When you're dealing in trade, everything's on the table. So NHS or anything else, or a lot more than that.
Backlash to President Trump's comments on the NHS led to many British politicians assuring their constituents.
Dang it, I can't get off the oi.
Backlash to President Trump's comments on the NHS led to many British politicians assuring their constituents that the NHS was not going to be a part of the trade talks.
The NHS is in no way on the table.
President Trump then backtracked on his comments, saying he wouldn't consider the NHS as part of the trade deal.
A lot of trade negotiations are actually quite secretive by nature. The two sides don't really want to reveal a lot about what they're looking for in a deal. Our concern really as health researchers is that the NHS really won't be accounted for in that deal, that the UK government's preferences have been shown to be largely economic and not so much on the focusing on the health of people in Britain.
The problem is that the NHS is already on the table. It has been for a while. But the politicians who are now going to be negotiating the trade deals, it's going to be across many fronts. Campaigners were saying, okay, put your money where your mouth is. If you're saying the NHS won't be in a trade deal, then let's see legislation that sets that out so it's cast in stone, and they haven't rushed to do that. Trade
negotiations cover everything at once, and it's difficult to tell how they are going to be pushing for the liberalisation of drug regulations and to what extent the Johnson cabinet would actually agree with any changes that would be proposed to the way the UK regulates pharmaceuticals. It's really a central government-led process that's not that democratic and does represent big business, and I think that's why a lot of people get very concerned and anxious around trade agreements.
There are some who say the NHS won't be harmed by Brexit, even in the event a trade deal with the EU isn't reached by the end of the year.
I don't expect that we're going to see huge changes actually in the Brexit era with regard to the National Health Service, and so I think with regard to the NHS, we're not likely to see a significant impact as a result of Brexit. I think the free trade deal will be largely focused upon the service industry, which of course is now the largest part of both the US and British economies.
Whatever effect the trade deals end up having on the UK, reforming the NHS will continue to be a big part of the country's political conversation.
People's support for the NHS in the UK is very strong. There's no other country that, when we hosted the Olympics in London, we had nurses jumping on beds, and the NHS was actually a part of that ceremony and a part of that national celebration. The UK's NHS is very important in British politics. It's an important symbol of Britishness in that context.
Really interesting. I hope I didn't come across as too, I know what it is, and here's, I very much am not knowledgeable in this stuff, but I like to learn about it. I really want to hear, again, any issues. Obviously, I want to hear good things about the NHS, but any issues, just so I can be, to be honest, like when I see something and someone just tells me an issue off the back, but look at all this good stuff, I'm kind of like, okay. But if someone kind of explains something to me and just like, oh, it's perfect, it's perfect, it's perfect, I'm like, either you don't really know that much about it, or you're trying to whatever. So obviously, American healthcare has a ton of issues. I am nowhere near qualified to talk about American healthcare either, honestly. There are many Americans who could talk about it, their experience much better, who've had more ailments and serious surgeries or very expensive surgeries that I've not had, that are, I'm sure, extremely debilitating. But I'd love to hear what you guys have to say. Very interesting. And I really have no solid, oh, the U.S. is the way to go, Britain is the way to go, Britain sucks, the U.S. sucks in terms of healthcare. I'm trying to figure it out. I'm trying to weed through all the bull crap of, my system's perfect, this one's not. And one thing that really confused me was, I'm seeing the best I can keep talking here without having to edit. But one of was the cataracts thing. So they were delegating cataract surgeries because it was putting a big strain on NHS workers who need to, and doctors who need to focus on other things. And so it's a big help. And they're like, all right, fine. But what are the, in terms of, so clearly the NHS doesn't mean, socialized medicine, whatever. I think that's sort of a boogeyman word, right? It's not, it doesn't scare me, okay? It just seems like something that the government is taking a part in. That you can still have private sectors or private hospitals. So I never even thought about this. And I just, towards the end, I'm like, wait a second. If the NHS is nationalized healthcare, then why are there even private hospitals at all? And I was going to ask, like, so if David Beckham, like someone, I'm just picking David Beckham because I know he's a rich, famous British person. If David Beckham has, a heart or some life-threatening thing, like a heart attack or a stroke, or Joe at the market, right? So random non-famous UK citizen, not rich UK citizen, are they going to get the same care? But clearly, because there's private things, then if you're really rich, you will be able to get care immediately and the best care you can, right? And so that's something that I usually associate with America, is that, well, American healthcare is the greatest in the world if you can afford it, right? But not many people can afford it. And so that's something that's kind of confusing me now. So you do have private hospitals and private doctors, but you also have the NHS. And I think that might be kind of the best thing. And I didn't see it as hypocritical or, ironic or going against your own values by delegating some things to the private sector, like cataracts. That's not something where I'm like, oh, caught you. Oh, you failed. See, national healthcare doesn't work. Of course, that's not the case. You should, if you're having a little too much traffic, delegate it. I think that's a smart move. So that's definitely not a hit to NHS to me. But it also confuses me now because what exactly are the rules? Can the NHS just close down the hospital just because it wants that service that they're doing in the NHS rather than the private sector? How do you delegate salary in a non? I mean, of course they have salaries for, you know, teachers and cops and firefighters that are paid on the tax dollar, but something with medical, something that has an extremely high degree of education, to how do you put a salary on that? How do you get raises and stuff? Maybe there's a way. Really fascinated by this stuff. Again, not that knowledgeable, but love learning about it. I hope I was okay, and I can't wait to see you guys' responses down in the comments. Love y'all. Hope you're doing well. Go easy, or just be civil down there. And I'll see you guys next time. Bye, guys.